Thank you, Chairman Cox, and thank you to everyone who's here. There is no doubt that we are dealing with a dynamic and ever-changing environment. Dr. McDonald and I were talking about the closest environment that probably exists to this as being in a combat setting. We've both been in combat settings and environments where you have ever-changing information, often not clear or complete information, and you're making a series of decisions based on the facts as best you know them, recognizing that at any moment or any period of time that they could change. But also, like a combat environment, in those situations, you have a team, and you are one team. And I think that the people of San Diego should take comfort in knowing that at least for us here in San Diego, this is not a jurisdictional issue, this is not a partisan issue, this is not one entity versus another. When we stood before you before, we had mayors and state leaders from across the sector standing in unison. Today, we're joined by our hospital partners, representatives of our major hospital systems. We have extensive meetings and conversations. When they need help, we help them. When we need help, they help us. And we will continue that with all of the sectors and all of the areas we are doing to advance through this difficult environment, making the best real-time decisions that we possibly can. We are going to today announce a series of actions that we are taking via a public health order. And I do think that that is an important point to reinforce. As you see a number of jurisdictions making a number of actions, we are making the actions with the advice and counsel of our public health experts and doctors, and we heed their advice, we heed their direction, and we move forward accordingly. But all of us have a complete understanding that at any moment these could change. We could very rapidly be in a situation where we are back before you with much more severe, much more drastic, and much more restrictive actions. And as a public, we should prepare not only for the increase in number of cases, the increase in the significant impact of those cases, but the potential increase in additional steps. With that in mind, today we are issuing a new amended order of the health officer and emergency regulation for San Diego County with new guidelines and new direction. The 11 new orders, which I will briefly read, and then Dr. Wilma Wooten will cover and be happy to answer and question in more depth. Number one, all public or private gatherings of 50 or more people are now prohibited. All non-essential gatherings of any size are strongly discouraged. So although we are moving the order from 250 to 50, we are strongly discouraging any gatherings of non-essential operations or non-essential functions. Nobody needs to have gatherings for St. Patrick's Day. These are the types of things that we are asking folks to come together and adhere to. Number two, all bars, adult entertainment establishments, and other business establishments that serve alcohol and do not serve food shall close. Again, all bars, pubs, entities that do not serve food shall close. All restaurants and other establishments that serve food shall close all on-site dining. All food service shall be by delivery or through pickup or drive-through. Social distancing shall be required for persons picking up food on site. So again, all restaurants throughout San Diego County, in-person dining is legally closed in San Diego County. All businesses shall enact social distancing and increase sanitation standards and shall make every effort to use telecommuting for its workforce. All businesses shall suspend any policy or procedure requiring doctor verification for sick or other leave approval. We do not need individuals crowding our doctor's time and showing up at our hospitals asking for a doctor's note. So all businesses shall suspend any policy or procedure requiring doctor verification. Number five, all public or private schools, colleges, and universities shall not hold classes or other school activities where students gather on the school campus. Parents of school-aged children shall take steps to ensure said children are not participating in activities prohibited by the order and that social distancing requirements are practiced. Number six, a strong recommendation is made that all persons who are 65 years or older, have a chronic underlying condition, or have a compromised immune system shall self-quarantine themselves at home. A strong recommendation. Number seven, non-essential personnel as defined in the order are prohibited from entry into hospitals or long-term care facilities. All essential personnel who show any potential signs or symptoms of COVID-19 shall be strictly prohibited from entry into hospitals or long-term care facilities. Number 8, hospitals and healthcare providers shall take measures to preserve resources, including delaying non-emergent or elective surgeries or procedures where feasible. Number 9, hospitals, healthcare providers, and commercial testing laboratories shall report all COVID-19 test results to the public health officer immediately after such results are received. Number 10, all persons arriving in the county from locations as found on the Center for Disease Control and Prevention Warning Level 3 Travel Advisory shall be subject to 14-day home quarantine and self-monitoring. This includes originating or connecting flights from the countries, including South Korea, Japan, Italy, China, Iran, along with any other country that is subsequently added to this list. Number 11, a strong recommendation is made for persons exhibiting mild to moderate symptoms of COVID-19 to self-isolate themselves in their place of residence until seeking medical care and treatment. We will have additional guidance on child care facilities. We are waiting for some state input and direction and guidance, along with some continued internal deliberation, but folks should stand by for these orders. In addition to the public health order that's being issued today, we want to update you on our efforts around the homeless. We are particularly aware of the prevalent danger associated with COVID-19 for vulnerable populations, and we've been taking a number of proactive steps to try and protect these populations. Hand washing stations, which was mentioned, are put out across our region. To date, we have placed 180 hand washing stations in 13 jurisdictions, including MTS and NCTD. We have 58 additional hand washing stations that have been requested. All 58 are being delivered today. We stand by and ready for additional requests, and when we receive those requests, we will fulfill those requests. Our public health nurses have been deployed to the region's bridge shelters. There are teams of public health nurses in each of our bridge shelters that are working there daily. They are offering training to shelter staff, but they are also screening hundreds of unsheltered and homeless individuals on a daily basis. These screenings include temperature checks of those patients. I went out to the Alpha Project shelter with Mayor Kevin Faulkner to check on the operations. I'm pleased with how it's going. And I just want to say I'm incredibly appreciative of our public health nurses. At a time when what we're asking most folks to do is stay at home and binge watch Netflix, our public health nurses are out there. They're in the rain. They're engaging with vulnerable populations. They're checking their temperatures. They're offering them aid and assistance. And our public health nurses are our frontline workers, and we are incredibly grateful for what they're doing. In addition to the efforts in the shelters, we have hot and foot teams that are out engaging unsheltered individuals who are not in homeless shelters. They are covering many areas of our region, and they will have public health nurses with them as well. We have 1,300 hygiene kits that our foot teams will be delivering starting tomorrow. These hygiene kits include information on COVID. They include soap and water, hand sanitizers, and other types of information, because we're trying to get engaged with everyone possible to make sure they're adhering and make sure they're getting the news about the resources that are available to them. Last point on the homeless, we have secured 227 motel rooms. These rooms are available to anyone who is a person under investigation, a person who is showing symptoms or a positive test, who does not have a home or cannot return to that home for isolated care. These facilities are staffed with health access personnel, food is provided, transportation, we've engaged cleaning and hygiene as well as security. Our aim presently is to acquire 2,000 motel rooms that could be used to try and shelter and help this population. That number could also increase as we move forward. Again, I want to reiterate, these rooms are designed for vulnerable populations who have been exposed to COVID-19, who are exhibiting symptoms of COVID-19, who are pending test results of COVID-19, or who are tested positive and cannot isolate themselves at home. These could include homeless and unsheltered individuals. They could include seniors in assisted living or senior homes who can't return to this. It could also include any member of the public who is suspected or positive but does not have the opportunity or availability to self-isolate at home. We know that there is a greater need for additional shelter capacity, particularly for the homeless community. We also know that the state of California, per Gavin Newsom's directive, is moving to acquire more rooms and provide trailers and more options. I also know the Regional Task Force on Homeless is moving aggressively to also get additional motel room capacity. We are supportive of all of those efforts. We will coordinate with all of those efforts, and those rooms will be designed for homeless individuals who are not showing symptoms or signs or at risk. But to be clear, the rooms we have are reserved for those individuals who we believe have been in contact or at high risk of having it. We've also requested the Mercy Ship be made available from the Department of Defense to aid in expanding our healthcare capacity, and our local congressional delegation is engaging us to be supportive of that request. Finally, in all of the sectors that we've outlined from the very beginning of this, we continue to engage with them all regularly, whether they be remote calls, telecalls, conference calls. Those are our business communities, our schools, our city and government officials, our healthcare sector, our faith-based communities, and others, and we will continue those engagements. We also have dedicated county staff assigned to each sector, and that county staff is there to be a resource every single day for anything that members of each of those sectors may need. Last point I want to make is we have had a request for individuals to continue to donate blood. As our society slows down and things slow down, people stop doing those types of things. And so we are asking and encouraging San Diegans to reach out to their regional blood bank participant to contact them and make arrangements to go and to donate blood so we can maintain the adequate supply that we need in our region. As we continue through this, we ask for your continued patience and cooperation and understanding of it. And then in closing, I just want to say that in most of these situations, as a community, when we say we come together, we actually mean we physically come together. We come together in candlelight vigils. We come together in houses of worship. We literally lean on one another. In this instance, in this time, we are still asking the community to come together. We're just asking you to come together in a different way. Proximity is not the option in what we're doing, but purpose is. And we're asking people to have a shared sense of purpose. Every single one of us has within our control the ability to slow the spread of the coronavirus. We have the ability to slow the spread of it by the actions we individually control and that we can take. And that's not just protecting yourself. That's protecting a senior citizen or someone who's vulnerable who you might spread it to. And so we are asking people to continue to heed these warnings and heed this advice and remind everyone that fear, COVID-19 can't detect fear. Being afraid or being anxious will not stop you from getting this. Channeling those emotions into positive action, those are the things that we can do to come together and try and stop this. Lastly, this morning we announced the San Diego COVID-19 Community Response Fund. We started with $1.3 million. We have already received substantial donations and contributions to that fund. This is a fund that's designed to provide help and assistance to our most vulnerable folks. If you live paycheck to paycheck and you're not getting a paycheck, you could be in a very dire strait. And although we're waiting on state and federal assistance, the reality is that may take a little bit of time. And so we are prepared now in partnership with the San Diego Foundation and the United Way to begin immediately providing assistance, rental assistance, food security assistance, income replacement to vulnerable communities throughout San Diego. And so we're asking San Diegans to visit sdfoundation.org/COVID-19 to make a tax-deductible donation. It's another action that we can all take to help one another. So again, thank you all for being here. And in particular, thank you to our incredible county team of public health experts and doctors who are working tirelessly to best inform the policy decisions we're made to protect the public. Thank you.